Good afternoon. Welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice. I'm stumbling on the P today. I don't know why. Anyway, my office is located in Encino, California, and I'm here along with my business partner and colleague, Dr. Robert Jaffe, who's also a licensed marriage and family therapist and a certified sexologist. The two of us, hypnotherapist. You are, see, I'm somehow spaced out today. Okay. And we are offering you at this hour a program on human sexuality and sexual healthcare. Welcome, Dr. Jaffe.
Thank you. Thank you. Yeah, so, you had mentioned to me that I used to do an introduction as to some of the qualities that we come into the world with.
Yes. And today we both are holding our heart-to-heart cups.
Heart-to-heart.
Yes.
Yes. Oops.
Oops.
Oh, I just dropped my coffee.
You just dropped your coffee.
Anyway, there's the heart. There's my heart.
And I happen to have a napkin handy.
Thank you.
You're welcome.
So we are born into the world, the vast majority of us, as our loving, authentic, true selves, and we come in with some wonderful qualities. We come in open to learning, open to new experiences. We come in curious. We all have curiosity. Okay, world, here I am. What do you have in store for me? We come in honest. We don't know how to lie when we first come in. We just comment on what we see. We come in with the ability to be emotionally connected to others. We come in, most of us, with our five senses intact, hearing, seeing, smelling, tasting, and feeling. We come in fairly confident. It's like, okay, now what? What's going on? We haven't had any negative experiences so far, so we don't know that any can exist yet. We all come in as sexual beings, and so that's a big part of who we are as human beings. There's no shame about it. It's just part of being human, and the goal of our sexuality is to help us to enjoy our lives better, and of course to propagate the species. And we actually come in fairly trusting. We trust that other people are going to be loving and kind and gentle, and we are very responsive when they are. And so these are some of the wonderful qualities that we come in with. And then we meet the world, and we meet people who have had negative experiences, negative parenting themselves, and sometimes they're not so nice to us, and we learn to conform to that. And as we conform to that, we begin to lose some of our authenticity and some of our belief. And so we're here to let you know that it can be reclaimed. And so that's what our the program here today about sexuality and relationships, at 4 o'clock about addictions and codependency and trauma. These are here to inform you on how to reclaim your authentic, your loving, authentic, true self, so that you can be happier, more fulfilled, and be more of a blessing to the world. And so that's why we're here.
And I do appreciate you bringing all that back to our program, because I believe that, this is such a true and such an authentic message that we can offer to our listeners, to our viewers, to say who we are, to say what is the purpose of life here, and what we can do, and we are who we are as our authentic true self, and we are not who we are told that we are.
Correct.
Right. So I'd like to invite you all to please join us to share your thoughts about this and everything that we share in this program. Our phone number here live is 951-922-3532. That's 951-922-3532. And we understand that if you don't feel comfortable to talk about anything live, so please do contact us via our uh, Facebook information, our private contact information, which you can find them at KMET webpage. And we look forward to hearing from you. And thank you for sharing the next 2 hours with us. You know, you have many choices, and thank you for choosing us. So, speaking of authentic true self, speaking of how we are here to be who we are and appreciate and value who we are, right? This is a month about, about gender identity, about, many things that society is not yet ready to accept, basically, even though there is no denying the facts, right? I see, in my practice, I have parents in particular who bring their teenage, child, and they say, my child says that he or she is gay. Can you please fix her or fix him? And my question for them is, what is there to fix? What do you mean by fixing? So they think that being gay is something that it's an illness, it's a mental illness, or it's something that can be fixed by therapy, or it's something that can be, changed because it seems abnormal to them, right? So now when I tell them that there is nothing wrong with their child, and they are actually, it took them lots of courage and risk taking to come out and say who they really are. And it's the parent who need to understand that, being anything but heterosexual is actually normal. And this is who we are, right? They are jaw-dropped and they think there is something wrong with me. And they say, what kind of a therapist are you? Right? And this is in particular true among the people of other cultures, conservative cultures, where in fact, when they are living in an open society like, America, their children who are not heterosexual, they feel safer to come out and actually talk about their true gender identity, right? And this takes, lots of courage. I really, they're going by saying who they are, they're going against so much of cultural belief. They're taking so much of a risk of being abandoned, risk of being rejected, risk of losing a connection that they have with family and friends. But ultimately, we can't pretend to be something that we are not.
Well,
we can't really live that way happily. We can't, it's just so difficult. So I do admire those that, they find safe enough, they find, they have courage enough to come out and talk about who they believe they are.
Right. And it's just, to me, it's just another prejudice.
Yes, it is. Yeah.
Which prejudice is a combination word. It's to prejudge. And why do you prejudge? You prejudge because you have learned from others what others believe and what others feel. You've learned that through reading. You've learned that through talking. You've learned that through your life, based on your own upbringing, based on your own culture, and a lot of people don't question what they've learned. And so, without questioning what you've learned, whatever you've learned, you hold as the truth. One of my favorite books is called The Prophet, by an Eastern gentleman, Khalil Gibran. He says in The Prophet, he says, "Say not, I have found the truth. Say instead, I have found a truth. But a truth isn't the truth. So a truth means that there are other truths, and perhaps one of the truths is that uh, it isn't a good thing for everyone to be the same.
Mhm.
That everybody is different, and they're different in their outlook, they're different in their genetic makeup, they're different in every life experience. And so our differences need to be honored and respected if we are to learn from each other. When we try to have somebody conform to what we believe, that's force.
Mhm.
And people don't enjoy being forced. If you ask yourself, listening, do you enjoy being forced to do anything? The answer will be no. And so if you try to force somebody, especially your child, to be something that they're not, they may comply out of fear, but they are not going to be happy.
Exactly.
And I think as parents, what we want most is for our children to be happy.
Exactly.
Yeah.
So, and this is so true. So, like you said, if you know what we want for our children to be most happy, so as part of that, it is our responsibility as parents to learn about our children,
Mm-hmm.
right? So when they come out and they say that they are gay and they're not heterosexual, just like their parents, instead of rejecting that, instead of becoming fearful about it, instead of becoming shameful about it, instead of feeling guilty that maybe they did something wrong, the
Mm-hmm.
parents did something wrong,
Mm-hmm.
and then the bigger shame of how we're going to face the society now that we know our child is not a heterosexual person.
Mm-hmm.
Why don't we learn about that?
Mm-hmm.
Why don't we educate ourselves about that,
Mm-hmm.
right?
Mm-hmm.
And then once we get educated, not only we are able to connect to our children that way in a more profound, depth that we need to connect to our children, they are going to feel so safe to come forward to us and actually talk about the challenges that they are facing in society with us.
Mm-hmm.
In other words, we are going to be the safe person, the safe people that they need to be with,
Correct.
right? But if we reject them, if we
Mm-hmm.
don't educate ourselves about these things,
Mm-hmm.
right, which are historically across centuries, they have existed. This is not something new.
Mm-hmm.
It's a new introduction because nobody, before had the courage to come forward
Mm-hmm.
because there were punishment, there were, consequences. But now we know this isn't true anymore, right? And we don't want it to be true anymore.
Well, those of us who have studied sexuality, those of us who have learned about the differences, and that differences don't mean better or less,
Right.
those people are at the spearhead of change in society.
Mhm.
Those people are the people who lead the way. The other people are following, and eventually the new information will become just as accepted as the old prejudices were, but it will be accepted based on a higher level of reality, a higher level of scientific understanding. It's like any prejudice. People prejudiced against black people because their skin was a different
Mhm.
color, and because they had a different way of being because they lived in a different part of the world, and thinking that whites are superior to blacks, and blacks are superior to Mexicans, and all of that. It's all prejudice, and it's disrespecting the sameness of us. And it's interesting because the word alien means other,
Yes.
right? Alien is an other than we are. And I learned very early on because I was a science fiction fan as a child, and I watched science fiction a lot. And I realized as I was watching it that when people came down from another planet with 5 heads and 12 arms, those were aliens. They didn't think like us. They didn't reason like us. They didn't, they were really different than us in a basic way. But then when I saw the people of Earth, well, we're all basically the same. We all have one head. We all have 2 eyes. We have a nose, a mouth, a chin. We have sexual organs, and so we are really not aliens from each other, except to the extent that we carry these prejudices.
I was called an alien one time because, when I first came in here with just, visa status, I had an alien number. It was actually written alien number.
Yeah,
you know,
yeah.
and that was a really, a huge surprise for me. Here I'm coming to the land of freedom. The first label I was given was an alien, right?
Yes.
And but so let's talk about this. This is a deep issue, and I like for you to call us. Let us know how you feel about it, what you think about it, what you believe about it. 951-922-3532, and we will get back to you right after our commercial break. Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM ABC News Radio. Dr. Mitra and Dr. Robert here. And for those of you who are just joining us, we are talking about human sexuality. And today we are talking about, gender identity and gay, lesbian, and all the other non-heterosexual terminologies, actually, which I'm going to introduce them shortly. And Dr. Jaffe and I are going to be explaining some of what we know and share with you. So as I was, saying before commercial break, Dr. Jaffe, instead of rejecting the coming out of our children, it's best for us to educate ourselves. What is it that my child is talking about, instead of freaking out, sort of a thing, right? I used to work at the psychiatric hospitals, and therefore, we had lots of patients who came in for a variety of mood disorders, psychiatric disorders. So, and some of that was suicidal attempts, right? Among the patients who came in for suicidal attempts, many of them who belonged to other cultures, not the mainstream cultures, and they had suicidal attempts was because of their gender identity and how they were rejected by their parents. And some parents even actually say, well, good that they attempted suicide, and they hope that they don't make it back. And I cannot tell you that how much that was hard to listen to, hard to hear, coming from a parent, just because their son, who was going to carry their names for the next generation, now happened to be a gay person. And then they will say, but how would he carry the generation when he is gay? How would he not have a child? So it is as though, children are not our trophies. Children are not, there to make us or break us. Children are here to, live their own lives. But this is something that, is hard for some parents to see. And parents who come from, closed culture in particular, this is very hard for them to see, to accept, to agree with, and, to have a, open-minded perspective to see what is my child is all about.
Can you maybe speak a little to why closed cultures have such a hard time with being open-minded?
Well, in closed cultures to begin with, I mean, it's not just in closed culture, but more so perhaps because, openness about talking about sex and sexuality started within Western cultures.
Mm-hmm.
But even among the closed cultures who live in the United States, still, for the most part, talking about sexuality is a taboo topic.
And why is that?
Well, that's based on, the nature of their society,
Mm-hmm.
as though sex is such a bad thing, it's sinful, and nobody should talk about it, in particular women,
Mm-hmm.
right? So this is due to societal norm of the culture and also religious beliefs,
Mm-hmm.
right? And to why is that? That's a huge anthropology discussion by itself. Maybe sometime we can open that up, right? But sexuality, in a way, is looked at as a form of, creating generations. So sex can only happen within marriage,
Mm-hmm.
and for the purpose of, having children,
So,
and in particular
so
sons.
these are religious beliefs.
These are religious beliefs,
Right.
right? Right.
And it's also, I think, a hierarchical kind of thing where men are more valuable than women.
Right. So in areas where son preference is a major issue, major factor,
Mm-hmm.
we see that more so. So imagine that a son of a family suddenly come out and say, guess what? I'm not heterosexual, so I'm not going to marry a woman. I'm going to, have a partner, male partner.
Mm-hmm.
Or imagine a female comes forward and says, guess what? I'm not going to marry a man. I'm going to have a female partner,
Mm-hmm.
right? So for those cultures, it's such a nightmare to face something like that, because what's going on is how people are going to judge them. So it's basically about how society is going to look at that parent, right? Which is such a shame, such a guilt, such a sinful situation to see. I've seen it in my practice a lot, and when I talk to, and they say there are some parents though that they say, okay, we just want to be sure that they are not confused, that the children are not confused. So that's, at least to me, it's a next step up, right? That at least they're open, but they just want to be sure that their children, is not confused, and so that they know exactly what they're talking about. So the reality is that, not everybody is heterosexual. There was a program, a TV show that I was invited to talk about bisexuality. And when I said, realistically, when we look at biology and all of that, everybody on the face of the earth can be bisexual. We all have bisexuality component with us. However, for somebody, bisexuality component is at 1% versus somebody else could be 99%, and somebody could be 50-50. Right? Correct. And everybody's jaw was dropped, and they said, some people even say, I'm not bisexual. I don't feel any bisexuality. And I said, yeah, so you're among the people with 1% bisexuality or even less. But it doesn't mean we don't have it. Right.
And of course, that gets demonstrated in prisons all the time. Right. Where men are in the men's prison, women are in the women's prison. But it doesn't stop men and women from having sex with the same sex.
Exactly. Just the other day, I have a male client who came in, and he said that he was confused about his sexual identity, right? So when I took a brief history from him, he told me from age 9, where he realized about his sexual feelings, until about age 20, 21, he only had sex with men, full intercourse with men. And I asked him, so did he try female, partners? And he said no, because in his culture, doing that is such a big crime. So he didn't try it. So he didn't know until his first encounter with a female whether he likes him. So that he believed that sex can only happen with men.
Wait a second. You said in his culture,
Right.
it's a no-no. What is a no? What was a no-no?
So that means if somebody outside marriage has sex with a female,
If he
it's a
wasn't
big
married to
crime.
the
Yeah,
female, I
right,
see, I
outside
see.
marriage. So it was safer, and he said this, and I was aware of that, but I didn't know the extent of it.
Mm-hmm.
He said that it is safer for boys around that age, range between 9 until 18, 20, 21, to have full intercourse with men because, nobody would know, nobody complains, they're happy with their sex life. So it's either that or masturbation. And that actually, they end up confusing themselves because they don't know when it comes to the having sex with a female partner, they don't know how to act, they don't know how to react.
Mm-hmm.
But they do it because, they have to, because of the law and the rules and the norms of the culture.
Right. And it's about being forced.
And it's about being forced.
Right.
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 So now he has lots of, issues going on with his sexuality, and he doesn't know whether he's actually gay or heterosexual.
Mm-hmm. Mm-hmm.
Right?
Right.
So when he
Right.
wants to have sex, he prefers a male partner.
Mm-hmm.
In his fantasies, he prefers a female partner.
Mm-hmm.
And so we see when society doesn't allow our sexuality to be, blossom.
Mm-hmm.
Exactly.
Mm-hmm.
Without education, people tend to find a way to satisfy themselves, to relate to what they believe is sexuality. They make meanings for themselves.
Well, our sex drive is the most powerful human drive next to survival.
Exactly.
So our sex drive will always find a way to get expressed.
Mm-hmm.
Now, if someone chooses, let's say, to not be sexual in their life, they block that energy. That energy will get expressed somehow.
Somehow.
Yeah.
Yes.
But usually people find a way to express their sexuality through some sexual acts. Could be masturbation, could be having sex with the same sex. But because the sex drive is so powerful, and because sex feels so wonderful, people want to have sex, and it's very difficult for people to let others know that they're different.
Exactly.
Yes. Differences are usually frowned upon.
Right. And so we see when there is no outlet to express, there is no outlet to explore, there is no outlet to receive education, to consult, to learn about what exactly sexuality is. People make their own meanings, and it can create confusion. When I explain this to parents, they say, well, we don't talk about these things. Okay. So that's why, I thought, maybe we can, devote today's program to help parents and others to educate themselves, because right now it's not just a matter of who's heterosexual and who's not. It's a new information, that new situation that people are facing themselves about how to address each other. Right? And I think this is something that we all need to be educated about. This is something totally new. In the past, when somebody was, we were either heterosexual or gay. That's what the only term was. But today we know that this terminology, is keep adding and keep growing. And so there's a tremendous amount of confusion among people, even among clinicians, right?
Well, clinicians are really just part of the culture.
Right.
And you think that clinicians are more educated and more evolved, and that is the case with some, but not a case with all.
Right. I remember a few years ago, not too long ago, I have, colleagues that they happen to be gay, right? So I was working on an article with them, and I used the terminology LGBTQ, and he himself is gay, and he told me, "What is Q?
Mm-hmm.
There is no Q. Why do you make up things?" I said, "I'm not. This is part of it."
Mm-hmm.
And he got really pissed off at me
Yeah. Yeah.
for adding Q, and he didn't know anything about it.
Mm-hmm.
And then, when we published the before we published the article, he actually came across what Q means, and then he apologized to me, and I said it's not his fault,
Mm-hmm.
because terminologies are keep growing and keep adding, and it's up to us to educate people about that.
And we're not
So-
talking about Q in terms of a political organization.
No, of course not. No. We're
Yeah.
going to talk about all of that. So we just got our notice about commercial break. So when we come back, I'm going to go over introducing some of the terminology and the source of where you can access all of the terminologies, have access to
We'll
them.
see you soon.
See you soon. Welcome from our commercial break. Dr. Mitra and Dr. Robert here at KMET 1490 AM, ABC News Radio Live. We are talking about human sexuality, and please call us 951-922-3532. We love to hear from you, because your information are just going to help us to do a better program and offer a better program to you, right?
Absolutely.
Right. So we were talking about some terms that currently are being used, and also many family members and people in society are kind of unaware of them. They are not familiar. It's nobody's fault. These terms, they were not previously, introduced at the magnitude that they are, recently. So here I'm going to introduce some of the terms which I received them from Gay and Lesbian Alliance Against Defamation. In short, it is called GLAAD, GLAAD. So they have come up with a guide to gender identity terms, which I think they are absolutely necessary for everybody to use them, and to understand them, to learn about, so that it just helps us to have a healthier and an easier and friendly interaction with each other. Mm-hmm. To understand and accept and appreciate our differences, rather than rejecting them and going against them, because after all, we cannot deny the truth of what it is, right?
Right.
And so in a code that they have here, and I'm reading from their webpage, it says pronouns are basically how we identify ourselves apart from our names, right? And it is how someone refers to you in conversations. And when you are speaking to people, it is really simple way to affirm their identity.
Yep.
Right.
Yeah. So the basic pronouns that everybody uses on a daily basis mm-hmm. are he and she.
Right.
Right. We identify people by their gender first.
Right. Exactly. I mean, mm-hmm. This is exactly what this, Associate Director of Gender Representation at GLAAD has said. His name is Alex Schmider, if I'm not mistaken. That he said that proper use of gender identity terms, including pronouns, is a crucial way to signal courtesy and acceptance mm-hmm. to each other.
Exactly.
Right. And this is so true. So the best place for everybody to understand about gender identity terms. So we have National Center for Transgender Equality. We have Trans Journalist Association, NLGJA. We have the Association of LGBTQ Journalists. We have Human Rights Campaign, We have the American Psychological Association, and of course, yes, we all always follow these guidelines through them. And then, so let's see, you know, some of these terms that I think everybody needs to first understand. And of course, these are closely related and similar to what World Association of Sexual Health has said.
Absolutely.
About defining what is the meaning of gender, gender identity, gender expression, what is cisgender, and what is transgender. So let's start from the beginning of them. So gender is often defined as a social construct of norms, behaviors, and rules that varies between societies and over time. Gender is often categorized as male, female, or non-binary.
Male, female, or non-binary.
Non-binary.
Uh-huh.
And then, so gender identity is one's own internal sense of self and their gender, whether that is a man, woman, neither, or both. Unlike gender expression, gender identity is not outwardly visible to others. For most people, gender identity aligns with the sex assigned at birth, and the American Psychological Association notes that for transgender people, gender identity differs in varying degrees from the sex assigned at birth. So we see, you know, you look at the variation here we're talking about, right? We're not just saying, you know, male or female. We're looking at so many differences here. So gender expression is how a person presents gender outwardly through behavior, clothing, voice, or other perceived characteristics. Society identifies these cues as masculine or feminine, although what is considered masculine or feminine changes over time and varies by cultures.
Right.
Right? Cisgender, or simply cis, is an adjective that describes a person whose gender identity aligns with the sex they were assigned at birth.
Mm-hmm.
And transgender, or simply trans, is an adjective used to describe someone whose gender identity differs from the sex assigned at birth. A transgender man, for example, is someone who was listed as female at birth, but whose gender identity is male. Cisgender and transgender have their origin in Latin derived of cis and trans. Cis meaning on this side of, and trans means across from or on the, and this is really on the other side of. Both adjectives are used to describe experiences of someone's gender identity.
Right. So someone who has been assigned a gender identity of male and who later in life being, could be early in life, but after birth, identifies as female, is somebody who believes that they have more in common
Mhm.
with other females
Right.
than they do with other males.
Right, right.
Mm-hmm.
And then non-binary is a term that can be used by people who do not describe themselves or their genders as fitting into the categories of man or woman.
Mm-hmm.
A range of terms are used to refer to these experiences. Non-binary and genderqueer are among the terms that are sometimes used.
So you're using the word queer, but you're also using the word gay and lesbian. So how is queer different?
You know, that's a good question. You know, I was asked this question before, and I guess I can find that out exactly about queer and bring it to our program next time.
Okay, that'd be good. Yeah,
Yeah,
because I've wondered about that.
yeah,
Mm-hmm.
yeah. Many people wonder about what exactly non-binary is,
Mm-hmm.
you know, and each term that I'm introducing here, there is so much literature behind them.
Mm-hmm.
So the reason I'm mentioning literature is because I want to bring the attention to the importance of this. Literature means research,
Mm-hmm.
means there are people that they are spending time and money to understand all these, changes, to understand all these differences,
Mm-hmm.
right? So that we can become more educated about.
Mm-hmm.
So that means they are real.
Mm-hmm.
They are not made up. They are somebody doesn't, wake up in the morning and say, guess what? I have decided to be a transgender today.
Yeah.
Or I have decided to be a gay or a lesbian person, right?
Mm-hmm.
These are real. These are people that they experience, their sexuality as transgender or as gay, as lesbian, and etc. And because they are real, science, the world of science is paying attention to that, and they're doing research and study, and they're spending time and money and energy so that they can better educate us.
Mm-hmm.
So I think this is such a valuable process.
Yes.
And this is something that we all need to allow ourselves and put our prejudices aside
Mm-hmm.
and allow ourselves to learn about it, to value it, to validate it, right? So that we can, connect and reconnect to our loved ones versus rejecting them and alienate them.
I think a lot of where we're headed as a human species is the recognition that we are all of us much more alike than we are not alike.
Exactly.
But that is very difficult for people because we grow up in a certain milieu of people, a certain socioeconomic status, a certain gender, and so other people are strange to us. And what's strange is usually what engenders fear.
Right.
So we tend to shy away from or condemn that which we don't identify with.
Right.
And I think it's important for people to recognize that fear is simply a way of separating yourself. And it manifests in terms of I'm better than you, which of course angers the person that we're saying that to.
Right.
And then that person wants to get even, and now we're in a war with somebody because they're different than us.
Exactly. Somebody, brought it to my attention, and then she asked me that, she made a mistake, and she, addressed somebody with her, believing that, she was, heterosexual,
Mm-hmm.
and then she didn't know what to do, and I said, well, the simplest thing and the basic thing and the best thing is to apologize,
Mm-hmm.
and also just simply ask how would that person need to be addressed.
Exactly. Exactly.
Because this is how we educate ourselves.
Mm-hmm.
Right.
Yeah. Yeah.
So we make mistakes and we don't know, we assume, right? And our assumption many times, are not accurate.
Right.
So just like everything else, that when we make an assumptions and we apologize for it, this is the same thing. However, the next step is to simply ask,
Mm-hmm.
how would you like me to address you? How would you like me to call you?
Exactly.
I am a member of this society that's about, human sexuality. And I remember that when I first enrolled to become a member, they asked me this. They asked me, how would I like to be addressed?
Mm-hmm.
And they gave me the pronouns, the he, she, all that. And I simply chose what was applying to me.
Mm-hmm.
Right.
Right.
And I think that's such a beautiful way to allow ourselves to feel safe, to introduce ourselves as who we are,
Mm-hmm.
rather than, being fearful, oh God, if I say my true gender identity, if I talk
I'm going to be hated,
right,
and scorned,
right,
and treated as though I don't belong.
Exactly. So there are so many information that we don't have. There are so many information that we do have, right? And I think anybody who is interested to educate themselves, whether you actually have or you do not have, gay friends, or you don't have, or you know people who are transgender or not, I think, getting the basic information, at least to start with, it's such a, wonderful gift that we are giving not only to ourselves, but also to those that, they're not heterosexual, so that we can, better communicate with each other and have an understanding of our differences, if that is, of course, something to be called differences. So the best place I would say to download this information would be Gay and Lesbian Alliance Against Defamation, GLAAD, GLAAD. And I think we just got our signal that our program is about to end.
Okay.
Am I accurate?
I didn't hear it, but I will trust if you heard it.
Okay, so yes, we
now
did. Yes. So thank you so much for listening to our program. And I would like to invite you to join us again next Thursday at 3 o'clock. We're going to continue with this discussion. And I would like to invite you to join us at the hour 4 o'clock today, so we can listen to Dr. Robert Jaffe about codependency, trauma, addictions impacting relationships. See you in a short few minutes.
Talk to you soon.
And until then, all you need is love.
All you need is love. Bye-bye.
The preceding was a paid program. Views and claims expressed are those of the program producer and are not endorsed by this station. Opinions expressed are not necessarily those of radio station KMET, its management, employees, or affiliates.
KMET banning.
Unaccounted for.
We are all praying. We are all crying. We are all here with the suffering families.
It's